Now I'm very pleased to introduce James Marcin, who is a professor at UC Davis Children's Hospital. He will present the EdgeNTech Athena Award for Early Career. Welcome, James.
Thanks so much. Thanks for the introduction, and good morning, everyone. It's an honor to be here this morning to help celebrate the EdgeNTech Athena awardees and to acknowledge the importance of diversity, equity, and inclusion as a core value of our everyday work. For all of us in our professional lives as researchers and educators, it is imperative to recognize the significance of striving to be an ally and to promote the advancement of female first-generation scholars from underrepresented communities. I'm particularly proud and honored today to introduce the Athena Early Career Awardee, Dr. Veronica Ahumada, the first female PI of an NSF National Robotics Initiative grant at not one, but two UC campuses. I first met Dr. Ahumada in 2019 when she was a postdoctoral fellow, and she reached out to me to talk about pediatric telehealth and telerobotics. She explained to me that her pioneering work in robot-mediated child development had started in telehealth, and she was looking for an academic home to grow her research and explore the use of robots in the daily lives of children who are at home due to medical conditions or disabilities. I've been working in pediatric telehealth for more than 20 years and was blown away to hear about how Dr. Ahumada had flipped the telemedicine model of care where teletech is used by the patient, not the physician, and the robots travel to real physical spaces, including schools, not just the doctor's office. After she reached out to me, I thought to myself, how could we not hire someone like this? So, after Dr. Ahumada completed her NIH-funded TL1 biomedical and health informatics postdoc, we were very fortunate to be able to recruit her here to the Department of Pediatrics at UC Davis Health, where she has already started to build a transdisciplinary team between medicine, engineering, and behavioral sciences. However, all of this has also made me painfully aware that we, as academics, have been asleep at the wheel. California's largest population is Latin Hispanic at 40%, yet they only make up 3.5% of the latter rank STEM professoriate, and Latinas in particular make up less than 1% of the STEM professoriate. How is this possible? As a community, we at the University of California must do better. A celebration like EdgeNTech is a great start, and I appreciate the opportunity for allowing me to nominate and introduce to you the incredible Dr. Veronica Ahumada.
Thank you, Jim. Thank you, everyone. Happy to be here and honored to receive this award. I haven't received it in the mail yet, so I don't have it to hold up. But just wanted to share a little bit of my story and how I came into studying robot-mediated child development. This is a second career for me. I was raised in San Gabriel, California. My parents immigrated from Mexico. Spanish is my first language, and I learned English in school, and that kind of started my whole love of learning. I loved school, loved going, but unfortunately, I was sick a lot, and so I missed a lot of school. And so I was homebound. I would have to stay home because I was sick for long periods of time, and my brothers would have to bring me my homework. And eventually, my congenital heart defects worked themselves out, and I was able to attend school and pretty much went on and kind of almost forgot about it. In my career, I went from really working in education, I transitioned into assistive technologies. And when I was working in assistive technologies, I was the director of learning resources and assistive tech, and I worked with disabilities. And I wanted to know, how can we use tech to help people adapt and interact in traditional environments? How can we use technology as a tool at the individual level so that the individual has some autonomy and more independence in their learning? And I was just fascinated by everything I learned with that and the different partnerships I had with foundations, with some industry partners. And from there, I went on to a career in public health, where I worked for the State Department. And I continued this grassroots approach of how can we adapt technology at an individual level to at a micro level to really affect change at a macro level. And while working for the state, I worked with all of our 56 county public health departments in transitioning them to an Adobe platform for reporting for our Title V maternal child health block grant. And so that really changed things, that partnership and that individual public health department reporting structure really changed things for us at the state. And while at the state, I began to work with telehealth technologies, and we were working, they were like global med health cards and some other telehealth technologies. And we were working with them up along the High Line by Canada, where we had trouble getting physicians to work. And as I worked on all of this, I was on the telehealth committee, and we helped do the CMS codes for telehealth services. And while I was working on that, I remembered that childhood experience of being home for long periods of time and missing school. And I wanted to flip the model and see if telehealth technology is of such quality that our federal government can reimburse physicians for diagnosing and treating medical conditions, is the technology of such quality that a child could use it to attend school, right? So we have different task values, whether we use technology for physicians to treat medical conditions. And I thought of this super high task value that some children place on going to school. And so in wanting to study this, I started to look for where I could study it. And I couldn't find a university that really was already studying it. And at UC Irvine, I had the opportunity to do my PhD there and kind of explore, how would a field like this be built? How do we begin to study robots for daily use by children in just traditional physical environments with minimal adaptation from the physical environment? Because that would take forever. Can we empower the child to control the robot in that remote space? And so from there, I began my pilot work, and I started working, and this is where my background in education came in. I secured external research approval in 3 of the largest school districts in the US, and that took a lot of time. Studying robots in the field takes a lot of background work and a lot of preparation before we even deploy the robots. And so that was my PhD dissertation work, which led to my postdoc. And I think in all of this, as I look at the Athena Award, the one thing I really want to emphasize is that diversity drives innovation. And so I'm so thankful that we have these awards, that we have, focus on increasing diversity and promoting the advancement of diverse voices, because your experiences drive your passions. And I feel that my personal and professional experiences helped me begin field building this area of robot mediated child development. And so I've been very thankful for the opportunity to do that. As we look at the use of technology for people with medical conditions or disabilities, we have this outdated mindset to illness that people should kind of just take it easy and not do too much and somehow get better. I think COVID has really raised awareness of what this, at-home experience is like. And so if you can all just imagine, from COVID-19, everyone else gets to go back to work except you. And that's kind of what my participants experience. Everyone else is out, but there is this illness, there might be illness out there that could really have dire consequences for them. And so they need to remain home to remain safe. And so that's how we use the robots. In addressing these outdated mindsets with robot use, I come across, different issues. There is resistance to this use of tech, the ethics, of using a robot in a public space. You know, what are the interactant's rights versus the remote person's rights? And so it's been a very fascinating field to kind of work in and build. So in translating, you know, I work in translational science. So we have these telerobots that were designed for adults in corporate settings. And so we've translated to a quality of life intervention for children. We have qualitative approaches that are my time's up. Stop, 7 minutes went by. That was me.
Thank you so much, Dr. Ahumada. Really, and thank you to James for the nomination. Veronica, we're so inspired by your career journey and your personal story. I think tying those things together with professional development is always so motivating and really brings a lot of depth and color to what then comes across in the technical accomplishments that you've also brought to the field. Telehealth and broadband access for health applications are topics that are really close to the heart of CITRIS and to CITRIS Health. So we appreciate these connections as well as the robotics. So pediatric robotics also is incredibly important and very close to what CITRIS is all about and the research that we're doing. So thank you.